Welcome back to the Med Education Flicks Masterclass on Medico-Legal Jeopardy. I believe every practicing clinician must be able to mention one landmark case that has altered modern medical practice for the better. In this section, we shall look at some monumental cases worldwide which have resulted in significant regulatory changes in the practice of medicine. In 1984, a young woman walked into a New York hospital. Her name was Libby Zion. She was just 18 years old. She came in feeling restless. She was on medication for depression. No one imagined that within hours, she would tragically pass away. Libby was taking an antidepressant called phenelzine. That drug belonged to a powerful class known as monoamine oxidase inhibitors. It made her highly vulnerable to dangerous drug interactions. In the busy emergency ward, the residents were stretched thin, tired, overworked, alone in the middle of the night. To calm her agitation, Libby was given meperidine, also known as pethidine, and later haloperidol. The combination was fatal. She developed severe muscle rigidity, uncontrolled high fever, convulsions, and violent swings in her blood pressure and heart rate. She slipped rapidly into cardiac arrest. By morning, Libby Zion was dead from complications of serotonin syndrome. Her parents demanded answers. Her father was a well-known New York lawyer, journalist, and former federal prosecutor. The case exploded into national headlines. It was no longer about one tragic death. It was about the system that allowed it to happen. The Zion case triggered sweeping reforms. The Bell Commission was formed. The following issues were identified. Resident fatigue. The resident was in the middle of a 36-hour shift. Poor supervision. When the resident called for help, the consultant ordered physical restraints by phone, never showed up. The most critical issue was poor prescribing, where potential drug interactions were not checked. As a result of this case and the findings of the Bell Commission, resident work hours were restricted and, most importantly, hospitals were mandated to provide direct senior supervision. Before we look at the next case, take a moment to reflect on this case and how it could modify your practice. Here is another monumental case. In the city of Bristol, England, a children's hospital carried a heavy secret. For years, infants and young children with heart conditions came here for life-saving surgery, but some never made it home. Between the late 1980s and early 1990s, the death rates for pediatric heart surgery at the Bristol Royal Infirmary were far higher than the national average. Children undergoing complex heart operations died at rates that could not be ignored, yet surgery continued. Families noticed. Parents asked questions, but the silence inside the system was deafening. Warnings were overlooked. The culture of medicine at the time valued silence over transparency. When grieving families refused to remain quiet, the truth broke into the open. A massive public inquiry was launched. It resulted in the Kennedy Report, published in 2001. The inquiry revealed systemic failings, lack of accountability, failure to audit outcomes, and a culture where doctors could not be challenged. The result was monumental. Clinical governance was born. The concept of a duty of candor emerged. Every hospital in Britain was forced to measure, report, and improve outcomes. The Bristol case changed medicine. It taught us that silence costs lives, that patients and families must be heard, and that transparency is not optional. It is the foundation of safe patient care. This next case is one you have to be very aware of. Sometimes the most dangerous mistake is the one hidden in plain sight. In 2018, Ireland faced a shocking scandal. Hundreds of women were told their cervical smears were normal, but many were wrong. Cancers were missed. Some women died without ever knowing their results had been misread. When one brave and amazing woman, Vicky Phelan, spoke out, the truth emerged. The system had failed in both diagnosis and honesty. The reforms that followed demanded transparency, double-checking of results, and a duty to tell patients the truth. This landmark case is a reminder that behind every sample, every test, and every report is a human life depending on us to get it right. Here is the key learning point. If the report says one thing and the patient behaves differently, you should always seek another opinion. Finally, let's look at another case from Australia that made global headlines, the Bundaberg Hospital inquiry. In a regional hospital in Queensland in 2002 and 2003, a quiet scandal unfolded. Behind the doors of Bundaberg Hospital, some surgical patients were suffering poor outcomes. A surgeon who had trained in America was linked to a series of disastrous outcomes and botched surgeries. He had not disclosed restrictions placed on his practice in America. There were unexplained complications and poor perioperative care. Patients died after some rather complex and sometimes routine surgery. More than 10 patient deaths were linked to his poor practice. A major inquiry was performed in Queensland, Australia. They resulted in the following reforms: stronger credentialing requirements for all doctors locally and overseas trained, the establishment of robust clinical governance structures in Queensland Health, the creation of independent oversight bodies to investigate and act on complaints. This case raised national awareness of accountability, the risks of failure of credentialing, clinical oversight, and patient safety in Australian healthcare. In summary, Libby Zion taught us that fatigue and poor supervision can kill. Bristol showed that silence in outcomes costs lives, and the reporting of poor outcomes is mandatory. Cervical Check proved that every test is a life at stake in the report, so be careful about test reports. Bundaberg reminded us that competence must be verified through a robust credentialing process. This concludes our masterclass on medico-legal jeopardy. We hope this section will transform your practice as a safer clinician for your patients and your own sake.